Would anybody would like to ask Rick some questions about this exciting new territory?
I'm Dorina. I work at ISIS as an RC. So this question is directed at Don Riedelmeyer. So I don't know if you want to slowly make your way up, or maybe Rick can answer this. I think you can both answer this question. So, from that very first cell phone use study to a change in legislation, how long does that take, and what are the facilitators to making really policy relevant research get from that, that data and that paper to, a change in legislation?
Great question. It's not as if you publish on Monday, meet with the Minister of Transportation on Tuesday, and enact regulations on Wednesday. It's a lot slower than that. You still have to go through each one of those bases, but you don't go through on the investigator's timetable. You go through at the government's timetable. So that I think it's incumbent for individuals to stick around and be available on the phone when somebody calls you up.
Rick Edwards, St. Joseph's Health Centre in Toronto. I'm wondering if you could say a word about potential for institutions like St. Joe's, which are, I might say, prominent local institutions, to begin using its population-type data for managing its local population. The health of its local population.
Oh, well, thanks, Rick. That's just a wonderful setup for, for an answer. We did publish this year a report called Hospital Care for All that looked at Toronto Central LHIN hospitals, not by the resident population of Toronto, which we normally do, but actually by the hospital population, and found enormous variation in demographics and socioeconomic status, not only between hospitals, but between services in the same hospital. The emergency department, mental health, and ALC had a very different socioeconomic characteristic than surgery, for example, and you can guess at what some of those differences were. I'll tell you, with lots of low income in the former group and not very much in the latter group. And that ISIS is very much engaged with support at the LHIN level, and that hospitals like St. Joe's have been very actively engaged, and Rick himself has been very actively engaged in working through these issues. And the next one that we're working on with the hospitals is immigration and language, now that we have better access to the Citizenship and Immigration Canada data.
And last question, David?
Rick, ISIS has historically worked with areas of the ministry that are responsible for health services, and perhaps not so much with areas that are responsible for public health. As we're doing more of this, and maybe the question might be fielded also by Vivek, and Arlene King was in the audience earlier on. Where are the policy levers? Where do they sit? Do they sit in the agency? Do you think they sit in the ministry? How do we now engage those partners if there is going to be changes in the light of these findings?
Well, this is a wonderful question, and this is part of the reason why I decided to come to ISIS, in fact, is that I'd worked in the area of health disparities for close to a decade, not finding policy partners, not finding, publishing lots of studies, but not finding much uptake or action from those studies. And I have to say that being at ISIS has helped me personally, and I think many others, connect with those policymakers. But in the area of health disparities, it's a challenge. It continues to be a challenge to talk about poverty, about race, about immigration, particularly these days with changes to refugee health. Actually, it's easy to talk about it, it's just not easy to do something about it. But finding engagement with the ministry, there are receptors, people like Vasanthi, who I believe we're going to hear from fairly soon today. Certainly there are lots of receptors like that. Public Health Ontario, led by Vivek and his colleagues, certainly is another receptor area. But I'd be interested if Vivek is here and has an answer to that, because it's actually a really, really good question. I found it challenging.
I think it's a great question, and I think we always work with public health at ISIS, but probably not at the same profile. And as Jack said this morning, the ministry's gone through many different versions of the health system itself. We had something called health intelligence units, and many people in the room that work for the old health intelligence units that link public health and the old district health councils together with health information and only with ISIS. So I think we have to keep reinventing things in Ontario in making those connections. The other comment, I think Don's comment is really important. if you get the broad social determinants of health, it's not just the Ministry of Health and Long-Term Care. Ministry of Transportation, Education, Children and Youth Services, Housing, it just goes on and on. And I think we have to figure out how we work with our ministry partners with all those other ministries to bring evidence to bear on good decisions.
So thank you very much. Another wonderful presentation.